So the front line is over, but we still have things to do that concern or border around that front line. I'll take you to Parliament, where 288 million Ghana cedis tax waiver for health personnel has just been approved. Joseph Opoku-Gakpo is joining me from Parliament. Hello, Joseph.
Hello, Gifty. Can you hear me?
I can hear you perfectly. So let's begin with what happened in Parliament.
Happy Workers' Day to yourself and
Very
the
well.
entire team, by the way.
Happy Workers' Day to you as well, and to the entire team. So, Joseph, let's begin with 288 million tax waiver that has just been approved.
You know, President Akufo-Addo announced that in one of his addresses to the nation that healthcare persons will receive tax waiver for a 3-month duration on their salaries, all healthcare persons. And additionally, those who are on the front line will receive a 50% allowance on their basic salaries, and which will be tax-free. And you know, Parliament is the only institution that can actually give tax waivers. Despite the President's announcement, it couldn't have taken any effect without parliamentary approval. The House gave that approval earlier today, both for the general tax waiver for all healthcare persons and also a tax waiver on the 50% additional basic allowance for frontline healthcare persons. A number of issues were raised because the minority, including their spokesperson on finance, Casey Latofosen, was drawing Parliament's attention to the fact that when the finance minister got approval that an amount of 1.2 billion Ghana cedis will be withdrawn from the stabilization fund in order to cushion the economy in the light of the COVID-19 situation, a provision in that indicated that there will be 241 million that would go into the tax waiver for healthcare personnel. So he doesn't understand how come money has been approved for the stabilization fund to pay for the said tax waivers on behalf of healthcare personnel, but additionally, that waiver is being sought right here in Parliament. There wasn't a direct response from government, but the MPs are demanding that government come back to Parliament with details on how that money will actually be spent. That's not the only COVID-19 related relief that Parliament approved earlier today. The House also approved what is described as the Income Tax Amendment Bill 2020. Now, the explanation we're getting is when it comes to the payment of pension contributions, the Tier 3, which has to do with private pensions and also the Provident Fund, anyone who has contributed into that for less than 10 years for those in the formal sector and less than 5 years for those in the informal sector, if you would want to do a withdrawal on that at any point in time within the duration, you pay an income tax of 15% on the amount that you are withdrawing. Now, what Parliament has done today is that they've approved an amendment so that if you show up to withdraw from your Provident Fund or the Tier 3 or other pension funds, and you show evidence that you've become unemployed as a result of COVID-19 related issues, or that you've lost your job as a result of COVID-19 related issues, then that 15% tax income will not be deducted. You get whatever amount you are withdrawing from the Provident Fund or from your personal pensions in full. Parliament approved that earlier today as well, and the final approval had to do with donations that are coming in as far as COVID-19 is concerned, whether it's equipment or any other tools. The approval has been given so that the 12.5% value-added tax, the 2.5% health insurance levy, and the 2.5% Get Fund levy, people who are donating things will not pay all of those levies. So those approvals were given in Parliament earlier today. Gifty.
Well, let's talk about the indefinite adjournment, which is one of the... Actually, before I get to indefinite adjournment, Joseph, you indicated that this applies to all healthcare workers. That has been a big debate. Does it include private practitioners? Did that clarity come in Parliament today?
That clarity came from the Finance Committee, which assessed the earlier request for approval before it was discussed on the floor itself. So Dr. Makasibe Ebua, who is the chairman of the Finance Committee, indicated that they quizzed the official from the Health Ministry on whether private healthcare people are also going to benefit from the tax waivers. And the explanation they got is that, yes, private healthcare people who are working with private organizations will get the said tax waiver, and that the health ministry has requested that the details of the various private healthcare providers who work with private firms be submitted to the health ministry. Some of them have submitted it, and that a vetting process is ongoing, so that then when the necessary approvals come through, then if it becomes necessary, a refund of the said taxes or something like that could be done. So yes, private healthcare practitioners beyond the public ones will benefit from the tax waiver that's coming in order to motivate healthcare personnel.
That's exceptionally exciting to me. This is something that I've been discussing and talking about here on this show or on our frontline segment. So I'm particularly excited about it. What people, the concern people have raised, by the way, is that don't we already have that data in our system, especially when we're supposed to be monitoring the work of these private healthcare facilities? But that's a debate for another time. Let's look at how Parliament ended today. This big thing about adjournment indefinitely, which became a tussle between the minority leader and then the speaker. Today, it finally happened. Give us a brief.
It did, and funny enough, Professor Michael Kwe himself was not in the seat when that happened. His deputy, JoyNews, was the one presiding over sitting, and he read a statement from the speaker himself, Professor Michael Kwe, about the fact that what is described as the closing addresses. He read that on behalf of Professor Michael Kwe, and just to quote a bit of that, he actually referred to that in his closing address, even as he delivered that. Professor Michael Kwe's statement, as read by JoyNews, made the point that the situation that actually led to the minority MPs expressing concern about the suspension and all is something that constitutes a blot on Ghana's parliament, which should not be repeated in this house. Those were the words of Professor Michael Kwe, as read out by JoyNews in connection with that. So the adjournment eventually happened today. What that means is that this particular meeting of Parliament has been suspended indefinitely. The expectation is that they may be back sometime ending of May. And what this means, it being an adjournment, an indefinite adjournment instead of a suspension, is that if the Speaker wants MPs to come back, he has to give them a 14-day notice before then he can call them back. As the minority leader, Haruna Idrisu, concluded his comments in his final address, he said for good reason he wouldn't want to go back to that issue, and so he didn't comment on it, except that Oseiche Mensah-Bonsu, who is the majority leader, noted that even after the whole brouhaha that happened on that Saturday night, there was a separate meeting at which there was a general agreement that the Speaker did not err in his decision to suspend instead of adjourn the House then. And so looks like everyone is happy now, and life goes on until the MPs return from this recess in order to hold two final sessions before this Parliament actually comes to an end. So when they come back, sometime getting to the end of May, they are going to sit up until sometime in July, and then they'll take another break and come back sometime in September, and then they'll do the final meeting before this particular.
Okay, just when Joseph was about to end, the technology decided to end for him. That's okay. So we're all happy. It looks like the minority is happy, the majority is happy, Speaker is happy. Let's take it as that. But just so you know, there have been some very good approvals being done in Parliament as far as COVID-19 is concerned. Approval for tax waivers has been done. Approval for Provident Fund withdrawals, you know, that takes away 15% if you can prove that you've lost your job because of COVID-19 is also there. And then approvals for donation waivers for donations as well. Joseph Opoku-Gakpo joined me from Parliament, giving us an update. Parliament has been adjourned indefinitely.